What are the best ways to rapidly bring your blood sugar up when you are sinking into hypoglycemia? Do you ever experience sudden shakiness, dizziness, or confusion? These symptoms could be a sign of hypoglycemia, a condition where your blood sugar drops to dangerously low levels. It can happen to anyone at any time but is more common in people with diabetes and those who skip meals frequently. When left untreated, hypoglycemia can lead to seizures or unconsciousness. That's why it's crucial to know how to bring your blood sugar up rapidly when you start sinking into hypoglycemia. In this blog post, we'll share some tips on the best ways to quickly raise your blood sugar and avoid complications from hypoglycemia. What is hypoglycemia? Hypoglycemia is a medical condition that occurs when your blood sugar levels drop below normal. For most people, this means having a glucose level of less than 70 milligrams per deciliter. When you consume food or drinks that contain carbohydrates, your body breaks them down into glucose, which then enters the bloodstream and provides energy to cells in your body. However, if you have insulin resistance or diabetes and take too much insulin medication or skip meals frequently, your blood sugar can drop dangerously low. This can lead to symptoms such as shakiness, sweating, irritability, confusion, and even loss of consciousness if left untreated. Mild hypoglycemia can often be treated by consuming foods high in simple sugars such as candy bars or drinking fruit juice. However, severe cases may require emergency medical attention for intravenous glucose administration. Learning more about the causes and symptoms of hypoglycemia is essential for managing this condition effectively and preventing complications from arising. What are the signs and symptoms of hypoglycemia? Hypoglycemia occurs when the blood sugar levels drop below normal, which can cause several physical and mental symptoms. The signs and symptoms of hypoglycemia may vary from person to person, but they usually develop quickly. Some common early warning signs of hypoglycemia include shaking, sweating, palpitations, or a fast heartbeat. Other symptoms may include hunger pangs or stomach cramps, headache, dizziness, or lightheadedness. As the condition progresses, you might experience confusion or difficulty concentrating. You may also feel irritable or moody and have blurred vision. In severe cases of hypoglycemia, it's possible to lose consciousness. It's important to note that some people who have frequent episodes of low blood sugar may not notice their early warning signs anymore because they've become accustomed to them over time. If you're experiencing any of these symptoms and suspect you're having an episode of hypoglycemia due to diabetes medication use or other factors such as missed meals, changes in exercise routine, it is best to check your blood glucose level immediately before taking corrective action. Causes of hypoglycemia. Hypoglycemia occurs when the level of glucose in your blood becomes too low. This can happen for a variety of reasons, including not eating enough or at regular intervals, taking too much insulin or other diabetes medications, and engaging in intense physical activity without consuming adequate carbohydrates. Certain medical conditions such as liver disease, kidney failure, and hormonal imbalances like Addison's disease can also cause hypoglycemia. In addition to these underlying factors, some people may experience reactive hypoglycemia after consuming high amounts of sugar or simple carbohydrates. Alcohol consumption is another common cause of hypoglycemia because it interferes with the liver's ability to release stored glucose into the bloodstream. Certain medications such as beta blockers and sulfonylureas used to treat high blood pressure and type 2 diabetes respectively can increase the risk of developing hypoglycemia. It is important to identify the underlying causes of hypoglycemia so that appropriate treatment can be administered. If you are experiencing frequent episodes of low blood sugar levels, consult with your healthcare provider to determine what may be causing them. The best foods to rapidly raise blood sugar. When your blood sugar is low, the quickest way to bring it back up is by consuming foods that are high in simple carbohydrates. These types of foods can be easily and quickly digested, allowing glucose to enter your bloodstream rapidly. Some of the best options include fruit juices such as apple or orange juice, which can raise blood sugar levels within minutes. A small amount of candy or other sugary sweets can also provide a quick boost in emergency situations. Other options include starchy vegetables like potatoes or sweet potatoes, white bread or bagels, and cereals with added sugars. However, it's important to remember that while these foods may provide a rapid increase in blood sugar levels, they should still be consumed in moderation as part of an overall balanced diet. It's also worth noting that including some protein alongside these high-carb snacks can help stabilize blood sugar levels after the initial spike. For example, pairing an apple with almond butter or having a slice of cheese with crackers can slow down digestion and prevent another dip in glucose levels. When dealing with hypoglycemia, it's important to have quick access to foods that will raise your blood sugar level immediately. By keeping some simple carbohydrate-rich snacks on hand at all times, you'll be prepared for any unexpected drops in glucose levels and able to treat them promptly. The best drinks to rapidly raise blood sugar. When experiencing hypoglycemia, it's important to quickly raise your blood sugar levels. One effective way to do this is by consuming the right kind of drinks. First on the list are fruit juices. These sweet and refreshing beverages contain natural sugars that can rapidly increase your blood glucose levels. However, make sure to choose 100% fruit juice without added sugars or artificial sweeteners. Another great option is soda or sports drinks that contain sugar. While these may not be the healthiest options, they can provide a quick boost of energy in an emergency situation. Milk also contains carbohydrates that can help raise blood sugar levels. Opt for low-fat milk to avoid excess saturated fat and calories. Coconut water is another great choice as it contains natural sugars and electrolytes which aid in rehydration while raising blood sugar levels. Herbal teas such as chamomile tea or ginger tea with honey can provide a soothing effect while also delivering a dose of simple sugars from the honey. Remember, when choosing beverages to quickly raise your blood sugar levels, always read labels carefully and choose wisely based on your individual needs and preferences. Rapidly raising blood sugar with exercise. One effective way to rapidly raise your blood sugar levels when experiencing hypoglycemia is through exercise. This may seem counterintuitive since physical activity can cause a drop in blood sugar, but moderate exercise can actually help replenish glucose stores. When engaging in exercise to raise blood sugar, it's important to choose an activity that you enjoy and that won't put too much strain on your body. Low-impact exercises like walking or gentle yoga are great options. It's also crucial to monitor your blood sugar levels closely while exercising. Keep glucose tablets or a quick source of carbohydrates on hand in case you start feeling the symptoms of low blood sugar. If you're planning on doing more intense workouts, such as weightlifting or high-intensity interval training, talk to your doctor first and consider adjusting your medication dosage accordingly. Remember that regular exercise is also beneficial for managing overall blood sugar levels and reducing the risk of hypoglycemia in the long run. Just be sure to take precautions and always listen to your body during any physical activity. Best ways to rapidly bring your blood sugar up when you are sinking into hypoglycemia. When experiencing hypoglycemia, it's important to bring your blood sugar levels up quickly. Here are some of the best ways to do so. 1. Consume fast-acting carbohydrates such as glucose tablets, honey, or fruit juice. These will be absorbed quickly and raise blood sugar levels rapidly. 2. Snack on foods that are high in protein and complex carbohydrates like nuts, cheese, or whole grain crackers. These types of food help stabilize blood sugar levels over time. 3. Use a glucagon injection if prescribed by your doctor. This hormone helps convert stored glycogen into glucose in the liver, which raises blood sugar levels quickly. 4. Get moving. Exercise stimulates the release of adrenaline, which can cause a rise in blood sugar levels when you're low. It's crucial to act fast when experiencing hypoglycemic symptoms. Delaying treatment can lead to more severe complications such as seizures or loss of consciousness. By following these tips, you'll be able to get back on track with stable blood sugar levels and avoid potential health risks associated with prolonged hypoglycemia episodes. Foods to avoid if you are prone to hypoglycemia. If you are prone to hypoglycemia, it is important to know which foods to avoid in order to prevent your blood sugar from dropping too low. First and foremost, it is best to limit or avoid sugary foods. While they may provide a quick boost of energy, the crash that follows can lead to a rapid drop in blood sugar levels. Processed and refined carbohydrates should also be avoided as they can cause a spike in blood sugar followed by a sudden crash. This includes white bread, pasta, and rice. Alcohol consumption should also be limited as it can interfere with the body's ability to regulate blood sugar levels. It is especially important for those with diabetes who are more susceptible to hypoglycemia. High-fat meals should also be avoided as they can slow down digestion and delay the absorption of glucose into the bloodstream. This includes fast food meals such as burgers and fries. Avoiding sugary foods, processed refined carbohydrates, alcohol consumption, and high-fat meals are all important considerations if you are prone to hypoglycemia. By making healthier choices when it comes to diet and lifestyle habits, you can better manage your blood sugar levels and reduce your risk of experiencing severe drops in glucose levels. Conclusion: hypoglycemia is a condition that needs to be taken seriously. If left untreated, it can lead to serious complications such as seizures or even coma. It's important for people with diabetes and those prone to hypoglycemia to always carry fast-acting sources of glucose with them at all times. The best ways to rapidly bring your blood sugar up when you are sinking into hypoglycemia include consuming foods high in simple carbohydrates such as fruit juice or candy, drinking sugary drinks like soda or sports drinks, and exercising if possible. Remember that prevention is key. Maintaining a healthy diet consisting of whole grains, protein-rich foods, and fruits and vegetables can help keep blood sugar levels stable throughout the day. Avoiding processed foods high in refined sugars and limiting alcohol intake can also help prevent hypoglycemic episodes from occurring. If you experience frequent episodes of low blood sugar despite making changes to your lifestyle habits, it's important to speak with your healthcare provider who may recommend adjusting your diabetes medications or insulin dosages. By following these tips and being proactive about managing hypoglycemia, individuals with diabetes can lead healthy lives while minimizing their risk of experiencing potentially dangerous low blood sugar episodes.